Okay, so we are live. Welcome to the Surviving Depression podcast. Um, I am very, very honored to have a friend, Katina Richardson. Uh, she goes by Tina as well, but she's a licensed mental health counselor. Tina and I met when we both worked at Excellus as case managers. And, from then, just kind of kept the connection and just wanted you to be on the podcast. So thank you for joining today, Katina. Really appreciate you.
Thank you so much for asking me to be a part of this. And yeah,
Absolutely.
we both kind of took our passions and just hit the road so independently with what we want to do, right? Just like this is what I want to do out in private practice. And I've been working with children for 20 years, so I'm
Mhm.
so happy. I'll talk about it to like anyone who
Absolutely.
listens. So this is great that you've invited me to do this. Thank you.
Absolutely. Um, let me introduce you then, Katina. So Katina is a licensed mental health counselor and a certified play therapist with a master's degree in counseling. She has been providing psychotherapy to children and adolescents since 2000. Her career started as a school counselor, followed by clinical mental health counseling at Unity Health and Strong Behavioral Health, leading to private practice. Tina has worked with children and families within the rural, suburban, and urban communities.
Oh yeah.
As a certified play therapist, she specializes in treating anxiety and depression with children ages 2 to 5, and Tina has extensive experience, education, and training in the areas of play therapy, child development, children from divorced parents and blended families, co parenting support, strengthening parent child relationships, traumatic stress, abuse survivors, children in foster care, and mindfulness meditation. So, yes, wow, thank you.
I mean, so
Uh,
many of those overlap. So when I cut them down and just sort of like like untangle them a little bit, all of them are still, woven into working with a child, like understanding their background and then giving parent support, understanding like the what the parents see at home and what the teachers see at school, and just like the child's history. So and
Absolutely.
it's all kind of just included in getting to know the child, and then just providing the play therapy for them.
Yes, for sure. And so I want to ask you, Katina, like, how did you first get into, this field and like, get this passion for children? How did it all start for you?
Well, the very last course I took to get my to finish my master's degree in counseling back in like 2000, um, was a play therapy course. And throughout the closing kind of courses that you take in grad school, a lot of the students ask each other, so what population do you think you want to work with? And I didn't know, like I had no idea. Older, younger, I had no idea. So as soon as I took the play therapy course, I was like, this is it. Like this is my jam. I can totally get into this. It feels so organic, and children, they're innocent, and it feels more like a preventative and like an intervention. Although a lot of kids do end up, coming in for therapy when things are already in somewhat of a crisis for them. In other words, like the symptoms and situation has been going on for a while. So yeah, that was it. Like I just took that course and I was like, that's it. So I knew what I wanted to do. And one of my first patients ever was 4 years old. So I was taking the play therapy course, and one of the professors is a supervisor of certifying a play therapist. So I did like a year of training. I think it's maybe like I don't even remember how many hours. So it's like videoing and supervision, and it takes like a year
Yeah.
to get the certification. It's weekly work.
Mm,
Yeah,
wow.
yeah. I mean, it's quite. It's like it really helps put value on a certified or registered play therapist versus a therapist who has toys in their office, which is fine too. But I noticed lately, like parents have been coming to me saying, I was referred to you, or I was referred for my child to get play therapy. So I'm so glad that that word, the combination of that play therapy is just more common. It
Yeah.
wasn't when I first started my career at all. Like even
Yeah.
10 years ago, it was like
Yeah.
no one really was a play therapist.
So the education and the awareness is out there now.
Yeah, I think people are really enjoying it and seeing that when
Mm.
children play, they
Yes.
behave their thoughts and feelings and experiences, and with the skills of understanding, their emotions and reflecting their emotions and sitting with them, that's how we can identify some depression and some anxiety and sort of teach kids how to label their feelings and like mirror their
Yes.
feelings, and kids will be referred for symptoms of depression. And if you even try to Google young children and depression, you won't find much as far as like diagnosis or symptoms, what to look for, not for like the age group that I work for.
Yeah.
Maybe like one or two studies that was done over the past 5 or 10 years, but it's not like as is easy to find as like symptoms of depression for teenagers and adults. Like it's just really hard to identify that with children because so many people just think it's a behavioral. Like
Right.
he needs he's seeking attention, just ignore him. He's acting up, he's acting out, he's or she's, just being disruptive right now and being too loud. And, it's a lot of that. And instead of just like, okay, let's look what's behind the behavior. Could it be some symptoms of depression? What's going on in the child's life right now? And I think I was talking about this the other day with you, is one of the biggest responses that I have when I talk about depression and anxiety, because they're so overlapping that when I say
Yeah.
depression, I often will say
Absolutely.
anxiety too.
Yeah.
And they're the two big umbrellas, and it's like this Venn diagram of them both kind of overlapping with, so many similar symptoms. Just that, one of the first responses I get from an adult is, well, what do children have to be depressed about? Like their lives,
Right.
right? Like they have nothing to worry about. Like why would a child come on, they're not depressed. Like what does a child have to be depressed about?
Yeah.
And then, you kind of like zoom out and just look at yourself. Imagine yourself in a child's body, the height, the lack of like independence and freedom to come and go, to make your own decisions, like, and then like trying to navigate through the stressors that are going on, maybe for them at school, if they have trouble learning, or navigate the stressors that might be going home with parents who are, in chronic kind of conflict, and maybe they're going through a divorce, or maybe the family has moved a lot. So a death in the family. So it's not just a kid crying and then you're like, okay, my kid's depressed. It's a chronic kind of thing that goes on for months and months. Like, children who have sleeping changes and appetite changes, and, they're afraid to sleep alone, or they're having nightmares. It's all worth exploring, not necessarily diagnosing, but it's worth exploring and getting to like the why. Why is this happening? It's not just, they're acting out, or they're doing it to annoy me in some way. I mean, maybe that's part of it, but like understand what could be going on for your child to cause the behaviors that are linked to the thoughts and the feelings.
For sure. Yeah. And so Katina, what age groups are you working with? 2 to 5 year olds, or are you working with, other, like primarily, or are you working with other age groups as well?
Right now, I mean, the past like year or so, I've really narrowed it down to kids 6 and under, and I have a pretty full schedule and lots of referrals within just that population. I just find it just so much more valuable to just be, like focused on this developmental stage and all that goes on in a child's life from like the 0 to 5 kind of range.
Mm-hmm.
And yeah, then I don't have to like go back and forth, but I can work with teenagers, and I really enjoy working so much with like middle school age kids and high school kids, even like college kids and like the elderly population. Like I've had a mix of of patients with, range of ages and depression symptoms. But, I'd say probably 80% of my work the past 20 years has been with children 6 and under.
I see. Okay. Yeah. And so like, you mentioned that like a parent will say something like, what do kids have to be depressed about? Like, are there some things that children say to you where you're kind of like, you hear a common thing from children where they're kind of like saying something, or is it just mostly the parents?
I don't know necessarily that I would see the standout depression symptoms while we're playing during a play therapy session. It can look like anger, agitation, being really unsettled in some way, and just being sort of like, I guess, defiant in a way, like almost kind of pushing me away, like they don't want to be, they don't want to engage. So
Right.
I mean, that could be a little, I mean, children that age don't have the language. I mean, there are kids that can tell their parents, like, I'm really sad, I want to go back to see Katina, things are going on in my life, but
Right.
it's so rare. And I don't think that parents should ever wait for a child to tell them, I've been sad for a long time. And
Right.
like it's either depression or anxiety, or something else for a child. That's always what's underneath all of it.
Yeah.
And then when you peel all that back, always, what could be underneath it is some biological components, which it's not my area of expertise. Like, there's no blood test or anything. So I just pretty much stick to what's going on in the child's life from the day I meet them and backwards,
Right.
what have they been through?
Yeah.
Have they had their own kind of medical problems? Have they lived with a parent with medical problems, and it's just stressful and sad? And kids worry because they don't know, they don't know what they don't know, so they
Right.
don't even know how to ask. Sometimes they just live in sort of state of fear.
Yeah.
And it can look like regressive behavior. Like, I see a lot of kids who parents will say, I get really annoyed because he or she talks to me in like a baby voice, and I like, it's so hard for me to think that's annoying. So I try really hard to just put myself in their shoes and just be like, okay, yeah, I guess I could see where that would be annoying, because your child is 6 years old. They don't talk like a baby.
Right.
But children will regress. That's part of what they do when they're anxious or depressed or really highly stressed about something. It could be anything, like there's a new baby coming. We're getting ready to move. They're living, in like more severe kind of cases in an environment where there's domestic violence, where there's, chronic abuse, mental abuse, physical abuse. And, I do see many kids, unfortunately, that have experienced sexual abuse that age. So, that is just,
Yeah.
it doesn't get any worse than that. And there's no better reason to bring a child in to
Right.
get some therapy when
So
they.
I got a question for you. With that being said, like, has there been a time, like, working with kids, obviously they're innocent a lot of times, right? And it's got to be hard when a child is hurting or in a very abusive or traumatic situation. Has there ever been a time where you felt like you had to step away from counseling for a while with this population because of the trauma to the kids?
I think what helps me most is continuing to educate myself. Like, I have to really dive into all there is to know about trauma, all there is to know about someone's reaction responses to trauma. And the more I can like feel closer to my own background, and like, unless you were raised by Buddha or Jesus, like, you have experienced trauma in your life,
Right. Yeah.
and it's just how it's come out. Either, it's stuffed down and you just overfunction and out throughout your life. But children, I think, have a difficult time doing that. So they're like, vulnerable and innocent, and it just comes right out. And especially while they're playing, it comes out. I mean, I see a lot of kids that are easily agitated, they overreact. They'll cry easily or get sad easily. But a lot of it, I should just say, is trauma related.
Yeah.
And it's the trauma I don't it's not like plane crashes, that kind of trauma stuff. It's
Right.
like stress within their school or home environment. Every
Yeah.
time it boils right down to that. The community, the home, the school. And I don't say that like in a blameful way. I just say
Right.
that in an encouraging way. Like, okay, once we know where the environments are to help kind of help this kid figure out what's going on in this kid's life, then we can work with it.
Right.
You
Yeah.
know, we can help resolve it and identify any problems that are causing this child to feel these heavy emotions, these big emotions,
Right.
and we could work with it. Like I was saying before, like maybe they have a learning disability and we don't know that yet.
Mhm.
Some kids have had hearing loss due to ear infections and they don't hear that well.
Right.
And, they need to get their sight and their hearing checked, and
Yeah.
they have chronic stomach aches and they don't
Yep.
know how to, right? It's like there's so many
Yeah.
reasons for a child to act certain ways,
Yes, for sure. So
right?
how do you how do you self-care, and like, you know what I mean? Like, kids struggling and suffering for so long, is this something that you're kind of like you're gifted in a way that it doesn't really bother you that much, or do you kind of take breaks for
Oh no,
yourself,
when
or
I get into the stories of each kid, because I see a child and as soon as I hear their story and get in touch with what their daily life is like it plays like a movie in my head over and over again. Like I see the child and I see all that I have learned about them,
Mhm.
right? And and yeah, if I sit with it long enough, all of these are dreadful, awful. And a lot of times I'll just kind of bond with the parents about that. Like, like this is so unfair that your child is going through this, like a parent in prison, or a dad or a mom who's just abandoned the child, and then one parent has to raise them and the child doesn't know what's going on, or even a parent with like major depression or like personality disorders that just make it really difficult to have relationships.
Mhm.
So bonding with the parents, I think, has helped me because sometimes they really need that too.
Yeah,
Yeah, they
definitely.
really need to just be sad
Yeah.
about what's going on, and then to kind of feel the joy of, um, okay, we can find our way through this.
Yes. Yes, having
There
that
is there
support.
is joy in it because it's like,
Yeah.
okay, this isn't like my child isn't cursed for life and labeled as like, suicidal or unsafe or anything. And I mean, sometimes the depression symptoms can get bad or serious enough where a child does need a lot of supervision. One
Mhm.
of the first kids I ever worked with was maybe 3 or 4 years old, and he had been in and out of a lot of different foster homes in his little baby life. And when during bath time, like he would tell his foster mom, like, I want to drown. I want you to drown me. I want to
Mm.
die. I want to. So it wasn't like, oh, he heard it in a movie and he said it once. It was like every bath time he would say this.
Mm.
Then parents have to like think of their entire home and safety proof their home. And it's not just like supervise the child, it's like really interacting with the child.
Yes.
The child always feels the emotional presence of the parent, not like you're breathing down their neck like a helicopter parent, but just
Right.
their presence, their emotional presence, like that makes you sad, and just to be a buffer. But yeah, I mean, in those circumstances where a child does express death, dying, I want to jump out the window. I mean, take it seriously, like you would an adult,
Right.
right? Like take it seriously, hide sharp things, call, let the pediatrician know, let the school teacher know. Don't keep it a secret,
Yes.
right?
Yes.
It's not,
Yeah.
it's not a secret. It's not shameful. There's
Right.
nothing to be ashamed about. It's like, if anything, it shows how smart and attentive and
Mm.
the wisdom and the compassion you feel for your child by getting the help, by talking about it, talk about it with other parents. And, I talk about it with colleagues too. Like you and I have had talks about kids
Yeah.
and stuff. And some of my close colleagues, sometimes I need to just tell them right away, like I met a child today and this is what they've gone through. And I just need to kind of deep breathe and just feel the joy of knowing like, okay, their life is going to get better from today on.
Yes.
like
So
hope. It's like the hope that's involved with it. But it's sad. It's tragic, I think. Sometimes I sit with that tragic feeling of like, this poor little baby has been alive 3 or 4 years and has already gone through more than like some people at 90 years old have gone through.
yes,
Right?
yeah,
Like,
right, yeah. And it's just amazing. Like I'm always trying to really normalize, mental health and mental illness amongst men, amongst black men. Like, and it's amazing that we have to normalize it in so many arenas, right? As therapists, for children, for parents, like it's
yeah,
on all battlefronts, right? In terms of normalizing,
I think the
mental illness.
language is becoming a little more common.
Hmm.
Like, I mean, I hear people say like triggered, and I,
Yes.
I mean, I don't know if they always use it in context,
Right.
but it's sort of, I feel like we're moving in that direction. I mean,
Yes.
there's still a huge stigma at any age, like you're saying, that black men or men that have come back from fighting in war, or
Mhm.
just like your child. Like, I don't want my child to be labeled as depressed or anything, which
Right.
isn't even a thing. The kids won't get labeled. That doesn't,
Right.
not a thing. Um, so
Yeah. Yeah, it's a lot. It's a lot, but I'm glad. So there are some steps forward being made for mental health and awareness, but then there's still the struggle in every individual home and community and things like that.
yeah, we always want to think like that happens to other people and other that happens to other people, and it's like a small part of the population, and it's not.
Right.
I think every human being, I mean, if you have a pulse, you are at some point in your life going to have some period of time where you experience depression and or anxiety.
Yeah, for
And
sure.
I would rather explore all of the options, uh, every avenue, exhaust every avenue before ever seeing a child get put on medication. Like, that is, for me, that's like the last resort. So
Yes,
I just want to make
absolutely.
that clear when I talk about depression and anxiety with children, that I don't think of medication. I think
Mhm.
of like, let's rule out everything that could be going on for this child.
Yes, absolutely. So how do you help a child? So a child comes into your office, dealing with depression. Like how do you start to help them to process their feelings or deal with the depression that they're dealing with?
Well, in our field, it's, if we really subscribe to the whole Rogerian kind of, and therapists that are listening will know what I'm talking about, Rogerian kind of approach, it's all based on the relationship. So a child needs to know from the very first time they meet me that I am present. It's non-judgmental. They are safe in my room. I let them know that I will tell you if you're doing something that you can't do in here. You can say anything you want in here, and you could play with any of the toys that you see. If you ever want me to play with you, you can ask me to play with you. And I think just given that, like, those amount of choices and freedoms, some kids, they are like literally like their jaw opens. like
Right.
like
Yeah.
what? You're not going to tell me to draw my family, or
Right.
to, it's, and there's nothing wrong with that. That is a whole different therapeutic approach. But I've learned and subscribe and do this with every single child I've ever worked with, is always non-directive. It's
Mhm.
not my therapy session, it's the child. So right from the moment they meet me, I have to really make sure that they feel my presence, that we start to build rapport, we start to build trust. Like, I start on time, I end on time, and I'm just as, not so much structured, but
Yeah.
I want it to be predictable in some way, even
Yeah.
down to like where I put the toys sometimes. So they
So
come
it's
through.
safe.
Yeah, if
So
there's a
it creates a measure of safety and
yes, yeah,
yeah.
it is safe in there. Like, I'm
Yeah.
not, um, yeah, like, I'm not going to overreact. I'm not going to yell at them.
Yeah.
If they're jumping around, I will just raise my voice and just let them know, like, oh, let's play safe in here. Let's put our feet on the floor, or whatever kind of directive I need to do, like in a safety sense, if someone's going to get broken or someone's going to get hurt. But
Yes.
other than that, yeah, it's building the relationship. The first like 4 to 5 sessions can be all
Yes.
trust building. I mean, that's like the first stage of life is trust. So
Yes.
if that's the first stage that has to happen, and it has to stay, that foundation has to stay all along.
Yes.
so that they know that they're like, okay, I trust her. I'm just gonna do whatever I need to do in here.
Yeah. So it,
You
it
know, like,
sounds like I'm gonna put my therapist hat on. It sounds like what you're saying is so that therapeutic bond and that environment of healing and understanding and empathizing that you create for this child opens them up to healing and expressing themselves in ways that that you can understand them better and they can understand themselves better.
yeah, it is. I mean, it's just like almost as simple and as complicated as that.
Right. Yeah, yeah,
You know?
yeah.
And
Right.
and I it's so nice to work with the population of parents that I have over the years who are so receptive to learning counseling skills.
Yeah.
And that's part of my job. It's part of what it's not like I'm the magic person that's going to like fix your child. And that that's not it at all. Like I'm going to get the foundation going and have the child learn to do stuff in front of me that they may hold back if a parent is in the room. Like, I don't want them to see me doing this with the doll, or I don't,
Right.
like kids will play differently when a parent is in the office. I see it a lot. So when I work with a child, it's just the child and just me. When I talk with parents, it's adult talk only. We
Yeah.
don't talk about um, behavioral modification. We don't talk about parenting in front of the child, because the last thing you ever want to do is show a child that their parent needs to be taught how to parent.
Right.
I mean, what a way to like undermine a parent right there from the
Right.
beginning. So everything is done separately, and the child will just pick different toys. I mean, there is a set list of toys, of recommended toys to have in a playroom.
Yeah.
Nothing that like you press a button and it makes sounds, and nothing like battery operated like an Elmo or something like that. It's
Right.
mostly like toys that children can be creative and build with, like no, the toys that are common in everyone's house probably right now if you have a child is like Legos and blocks and Tinker Toys and Lincoln Logs and Barbies and dolls and stuffed animals and
Right.
yeah, all that kind of stuff, like little fine motor skill stuff. And then I don't really have a whole lot of room in my office for a large motor skill, but I do have a couch that some kids will want to jump on, and I like
Right.
it's okay with me. Like you in
Yeah.
here, you can jump on that couch. So
Right.
so there is a sense of freedom, and I think once they know that, and their feelings are constantly like being reflected to them, like, oh look, that makes you so happy.
Right.
One of the first things that a parent will tell me when I say, okay, what are you seeing outside of the session, is he's been like telling me more often, like, I'm really mad right now, mom,
Yeah.
or dad, I really don't like when you do that.
Yes.
So I know that's not always what a parent wants to hear, but it's much better than a child
Not expressing. Right.
more like swiping the table clean of all the glasses of milk or something. It's much.
Right.
We would rather hear a child verbalize their feelings,
Absolutely.
act them
Yes.
out, right? And
Right.
that has been consistently one of the first kind of pieces of feedback I get from parents when they tell me after maybe 4 or 5 sessions, like, oh, I kind of notice, he's been expressing emotions like here more
Yeah.
and with his body. Like, yeah, they
Yeah.
may cry a little louder, but they also be maybe more consolable. And
Yes.
yeah,
And that's amazing, right? Because like if a child is holding all that stuff in, right, it's contributing to more, you know, challenges within them. But if they're able to express that, how much healthier are
exactly.
they as
And that's
individuals,
what they
right?
do in play. That's what they do
Yeah.
during play therapy.
Yeah.
They're like, okay, I can do whatever I want here, pretty much everything that I want to do.
Right.
And once that's all kind of unloaded and unpacked for them, and they just usually by 10, 15 sessions, some parents will say, okay, I'm seeing such consistent
Yes.
improvement every week we have to meet. That let's start thinking about going every other week, every 3
Yeah.
weeks, maybe counting down like 4 or 5 sessions till we say goodbye. So it's not meant to be forever. The only long-term children that I've really worked with are the ones that have been really, really severely neglected and abused in different foster homes. And that, that's like, I consider that kid to be, like under my wing for just as often as they need and as long as they need it. So
Right. Right. So are there are there any tips or anything you'd say to a parent who's maybe on the fence about bringing their kid to counseling, or is there anything you'd recommend or just encourage a parent out there who's listening and
Yeah,
just
you
has
know
some
what I would
questions?
say is when you notice just about every day or every week or in certain circumstances or situations that you constantly have to tell your child, like calm down, lower your voice, no hitting, no hitting, no hitting. It's like that's worth attending to. That is a child who's just not getting their needs met. And it's not the fault of the parent. It's not the fault of the parent. It's like just knowing that, okay, the parent, it's a signal, it's a red flag. Look at it as
Mhm.
like, okay, it's a red flag. I'm going to talk to the pediatrician, and I'm going to talk to the teacher at the school and see what they see at school. And um, yeah, just don't ignore, don't just ever tell yourself this is just normal childhood behavioral stuff. I mean,
Right.
especially if you have another kid who doesn't act and feel in those ways, and one does and one doesn't, like, we're all built differently, and we all respond to stress differently. So um, dig more into finding out, like, why is my child wetting the bed, and why does my child seem so needy and can't separate from me without like throwing up or breaking down in tears.
Right.
So yeah, it's worth looking into. Don't just ever chalk it up to, my child is just it's normal.
Yeah. Yeah. Is
When
that
you
your
see
dog
it,
I hear over there?
oh my god.
It's
Yeah, he's
a,
like 6 feet away from me, and you could hear him.
oh, okay. It's all good. Uh, it's a cute dog too, right? It's a bulldog, right?
English bulldog, yeah.
English bulldog, yeah. Um, so uh, what are there any special projects you're working on? Like, you're in private practice. How, like, what trajectory are you going on with private practice? Like, do you plan on being like a national speaker at some point, or like what's
Oh my
going on?
goodness. Well, that's like that's one of the things I'm not afraid of. Like, I've always been okay with public speaking, and I, I don't even. I think there's already so many maybe people throughout the country that have that place at the podium, but
Mhm.
I, I'm happy to talk about anything I can talk about that I've learned in either books from like gurus that I followed, like therapists who have been have had a huge influence on me, and through working with kids and parents. Like, I can only share what that part of what I have. But yeah, I would love to. Maybe if you write another book, you can save a chapter for me.
Whew. Yeah, you know what? I actually thought about that. I actually thought about writing like a book with multiple, authors in it. Like, I think that would be good, especially bringing some
Yeah,
more
a
awareness around mental health.
compilation,
What's that?
a compilation
Yes.
with your podcast people,
Yes. That would be
and
great. That would
women
be great.
to
Yeah, I
just
really would.
yeah, it's just so worth it for parents. I would just say to get to know your kid. And when you're talking with someone who knows kids, me, and I
Yeah.
have a 16-year-old myself, so this whole play therapy and being a child therapist has really helped me as a parent
Yeah.
to listen, to be like a listener and then a responder versus like reacting. So
Absolutely.
where was I going?
Yeah. So what do you see long term or short
No,
term for like private practice?
I want to stay right where I am. I mean, I'm 50, so I'm like, okay, I'm until I retire, so that's it.
Right. Yeah. No,
Um,
that's good. Yeah.
yeah, I was saying something I forgot. Maybe it'll come to me.
I think we talked about the compilation, the book, then we talked about national speaker, and then I yeah, I just essentially, wanted to know just and I know we've talked about it a lot, back, when we were working together, but being in private practice is so liberating, right? It's such a liberating.
Yeah,
It was like, I remembered you telling me, and if you know how it is, like you hear someone saying stuff, and then you're like, you can't really understand it until you actually experience it. but it truly was and is liberating. And
That's
so,
right. I was kind of like poking you every now and then. Just, like, come on, just join
yeah,
the private practice world,
yes,
especially when you have such a passion and knowledge and belief in what you do.
yes,
I mean, that's I think a big thing that I've learned too. Like, I believe in what I do, and
yeah,
I read. I just gravitate towards most things in life that are that I'm learning, podcasts or books,
mhm,
recent journal articles about children, about depression, about development and parenting. Like, the parent-child relationship is so significant.
yes,
So
yeah. No, that's great.
I mean,
Well,
I'll
let's
keep doing
that
that. But
yeah, like really what you enjoy and what you're passionate about. And if this is your thing and this is like
yeah,
what you're doing
it's your
long term.
focus. Yeah, I've
Yes.
always thought, like, instead of being the jack of all trades, like,
Yeah.
just master kind of what you believe in and what your skill set is, and just keep moving. So I think I'm moving forward, like, in ways that aren't moving my office somewhere or
Right.
collaboration out in my future with anyone. But there is a growing population of child therapists in the Rochester area, and there is a Rochester area child therapist contact list available.
Oh wow.
Just
Okay.
contact me and I will get it to you.
Okay. Yeah.
There's a
And
lot of child therapists in the area.
how can our listeners best contact you if they decided to reach out? To email or
Yeah, it's Katina, my first name, Catina dot
mhm.
lmhc@gmail. So email me and I can send you a list. I update it every 4 months because we have a Facebook group of the Rochester area child therapists. So I ask them, say, okay, who's new, whose contact information is changing, so I could add that to the list. We send it to schools and pediatricians and parents, and
That's awesome.
I don't even know if one's ever been invented before, but it's great to have, because there are, I don't even know, there's something like 30 or 40 therapists on the list that are all child and adolescents. Most therapists that work in the child adolescent group focus on probably like 10 and up.
Yeah.
So
Yeah.
that's why this is my niche, and this is where I belong. So
Yeah.
yeah, so contact me if you're listening and you would like a copy
Yes.
of the child.
That's awesome. Well, hey, we're coming up on the end of our time. I really, truly, truly want to thank you for joining. You know, you could have been doing something else better with your time, but you decided to do this. So I appreciate it.
No, I've been
Um,
looking forward to this. This is so
yeah,
exciting. But yeah, I'm so grateful for you inviting me to do this.
yeah, this is a pleasure. And you know, if I do
Yes.
more down the road, I'd love to have you on again. I don't know how far it'll go, but hey, we'll see. Just trying to educate the people. But
What do they say on YouTube? Like, subscribe here for
yeah, subscribe. Go on
click on
YouTube.
the link below and subscribe.
Yeah, you know, I send it in the link. I send it in the social media post, but I'll say it again. Yeah, go on YouTube, Surviving Depression channel, Facebook Live. Watch it again on Facebook. Listen to it on the podcast, Anchor, Spotify, Google Podcasts. You can catch it there on Surviving Depression. And again, my guest, Katina Richardson, thank you so much. And I hope this was educational for the listeners out there. And join me next episode. Thank you again for joining the Surviving Depression podcast.
Bye, Carl. Take care.